guys, how you doing? Today, we're playing Edheads virtual hip replacement. Yeah, I know, it's kind of weird, but we're playing it. I love Edheads. It was one of my favorite websites when I was I don't know. I think when I was like eight or something. So we're playing virtual hip replacement. Yeah. But before that, let's look at surgery photos, because that's pleasant. Oh, I forgot to mention, for squeamish, turn away. So beautiful. Even I feel a little grossed up with this. Yep. Okay, let's go back to the front desk and let's do the thing.
Hello, and welcome to Edheads Virtual Hospital. I am the resident surgeon, Dr. Fisher. Today, you will help me perform a hip replacement surgery. Before we scrub in, let's complete the pre-op work for this patient. Ready? Our patient is a 62-year-old female with fairly healthy bones. She is 5 foot, 8 inches tall, and weighs 190 pounds.
All right.
Based on this patient's x-rays, which hip do you think needs surgery?
Could go at the right lip.
Great job.
Yeah.
As you can see, most of the cartilage or cushion between the bones is gone, especially in the upper portion of the hip joint. Now, we must template or measure the hip to determine what size prosthetics to use. I'll hold the templates up to this x-ray, and you find the correct fit. The stem, a metal piece that will fit into the femur, should be no wider than the canal in the middle of the bone. Which size stem do you think works best for this patient? No, not quite. Great work.
Okay.
Now we need to determine the size of the metal cup. Again, using a template. Which size do you think will work for this patient?
That?
Nope. Try again. Yes, that is
okay.
correct. The OR team has prepped and draped our patient. We are now ready to operate. First, locate the top of the greater trochanter bone and use the sterile marker to mark the incision area.
Alright, I'm not gonna mark an X. I'm gonna mark something more awesome. Let's do... Come on, can we fit ATAG? Come on. Yeah! Awesome! Now you'll know that a real doctor...
Start 3 centimeters above the greater trochanter and go down 5 to 10 centimeters below the greater trochanter.
Yeah, I think that's good.
Pick up the scalpel. Carefully cut through the skin and the subcutaneous layer of fat, following the incision line you just made.
I'm gonna cut you. Yeah!
Wait a
Oh, man.
Let's use the Bovie pencil and cauterize the vessels to... Now use the lap sponge to soak up the remaining blood.
Awesome.
Insert the retractors.
Oh, here it goes.
Using
beautiful.
The scalpel, cut through the gluteus maximus muscle. Again,
Gluteus
cauterize
maximus
any blood
muscle.
vessels using the Bovie so as to reduce blood. Pull back the split muscles using the deep retractors.
More muscle.
It is critically important to protect the sciatic nerve through this procedure. Why?
I'm gonna guess it's B.
Good job!
Yay!
I already cut the 6 muscles that connect to the top of the femur. I then folded the whole set of muscles back as one flap. Now, we are able to see the flexible sac, or capsule, around the joint. Cut open the... Next, dislocate the femoral head by flexing and rotating. We can now see the back of the femoral head and how arthritic the joint is. Before we saw into the femur, use a retractor to protect the sciatic nerve and external rotator muscles from an accidental slip. Now, take the bone saw and cut through the neck of the femur.
Hey. Okay, guys, so we're gonna have to cut through this guy's bone. A little disturbing, but...
Remove the femoral head.
All right.
During pre-op templating, we decided to use a 52mm prosthetic cup. We will need to use reamers that are slightly smaller than that in order to prepare the bone for the cup.
Oh,
Let's start with the 46mm
we're
reamer.
doing whatever
We'll
that
aim the
is.
reamer toward. Why should we try to ream more towards the top?
Surgeons are academic overachievers and always aim for the top. Oh, that's hilarious. Yes. Like,
Yeah!
oh, yay!
I'll finish with a size 51mm reamer, preparing the acetabulum for the prosthetic cup. Note that we are staying one size smaller than the final 52mm prosthetic cup. The prosthetic cup is mounted on an insertion device, which also serves as a guide to achieve correct orientation. Align the insertion device with the guides.
Shake, shake, shake.
The part of the metal cup that is in contact with the bone is rough, allowing the bone to attach or grow to the cup. This is known as bone in growth and is important to the long-term stability of the prosthesis. Tap the cup into the acetabulum until the bone completely surrounds the edge of the metal cup.
Yeah, I will
Plastic liner
hammer
will
it
act
in
as
there.
a cushion between the metal parts of the prosthetic.
It's
Tap the
hammer
plastic
time.
liner into the cup,
Stop.
and I'll lock it into
Hammer
place
time.
with an expanding metal ring. The liner is designed to offer a bit more coverage at the top back part of the cup. Why would this be the case? Not quite.
Obviously, because it looks a lot cooler. That is the right answer. Just kidding.
Great work.
Yay!
Place a retractor directly under the femur, near where you removed the head.
Okay.
This will elevate the femur. Use the
Ouch.
box osteotome to cut a rectangular segment out of the femur.
Wha-bam!
This will allow access to the medullary. Remember, we've templated this patient to a size 13 stem. Start with a size 12 rasp to size the bone for the stem prosthetic. Use the mallet to tap the rasp into the bone.
Yeah! I'm gonna cut into your femur.
Good. I'm going to rasp the bone again using a size 13. Take the handle off the final rasp.
Wha-bam!
Place the trial ball onto the end of the rasp.
The ball.
I'll
What?
pop the ball into the plastic cup. Now we're ready to
Okay.
test the range of motion, making sure all the components are the correct size and that the leg is able to move freely.
Nice.
The first
leg.
test is leg length. Check to see if the kneecaps and the heels align with each other. Are they in alignment? Great job!
Okay.
Next, rotate the foot and knee out and away from the other leg.
Wow. Dun-dun-dun-dun-dun-dun-dun-dun-dun.
Great! This indicates a good range of motion in those directions and that our patient's hip will be stable. Now, let's check the
Nice.
forward and inner rotation of the hip. It looks like we have good motion in that direction. Now move the knee down toward the table. She has about 60 degrees rotation in this direction, which is a good number. It looks like the prosthetics are a good fit for this patient. I'll
Okay.
dislocate the ball from the plastic cup and remove the ball and the rasp. Before we put the real prosthetic stem in, the osteophytes or bone spurs will need to be removed. Use the rongeur to remove the osteophytes.
Oh, the rongeur. How important. The rongeur.
Why does
That
the
sounds
patient
so
have
fun.
osteophytes?
Hip bones. From taking too many calcium pills, causing the bone to grow too much.
Yes,
Oh.
that is correct.
Yes,
Finally,
that
tap the
is
prosthetic
correct.
stem into the femur bone.
Wha-bam!
Place the ball on the end of the stem. I'll pop the ball into the plastic cup.
Where?
We're almost finished. Let's close up the incision. Take the suture down through the piriformis and the external rotate. Using the needle,
I'm gonna
suture the
stitch
I'll
it
close
up.
the gluteus maximus and then the tensor fasciolata tendon. Now you suture the subcutaneous fat together.
Woo!
This is an important
Look at
step
this.
to ensure
This
the
is
incision stays
insane.
together until
That's
healed.
awesome. Alright, I'm gonna stitch you up, alright.
Now use staples to close the skin. The OR team will bandage the incision.
I'm gonna staple your skin. And if I've stapled my finger once, and it did not feel particularly well. So,
You've
yeah.
done a great job. I can see a promising
Woo!
career in orthopedics for
Yeah.
you. Our patient has made it out of the OR and will stay 2 to 3 days in the hospital, followed by 6 to 8 weeks of recovery and physical therapy.
Woo!
This will allow her muscles to heal and strengthen. She should have significantly less pain and a much higher quality of life. Come back
Much higher.
and assist us anytime.
Yeah! Well, that was it, guys. Hope you enjoyed it. And if you did, be sure to hit that like button. Like it's like that thingy that I was hitting with the mallet. Hit that like button using a mallet. Don't smash your phone or your computer. But I'll see you next time. Goodbye.